with Reec.
Hey, I'll take it, man. Listen. Before we even get all the way into it, let me go ahead and introduce my co-host with the most.
The one and only Miss Juicy, baby.
The angel has gotten her wings once again. We got my boy JP. He will be joining the show in a second, as well as Bevie Stitch. But right now, we had to do our social distancing thing because we have the one, the only, the hip-hop doc himself. Dr. Collier is in the building.
Yeah.
Dr. MJ Collier live in the studio on Reec Radio. It is an honor and a privilege to be here today. I'm so glad that you guys asked me to come in because we want to bring some good health information to the listeners of the Reec Show. And let me tell you, there are a lot of people out there that are going to benefit from today's topics. We're going to talk about what's going on with the coronavirus, of course, and then vaccine reluctance.
Yes.
Why are some people, particularly in the African-American community, not wanting to get the vaccine? And then any other healthcare topic. Black people die from heart attacks and strokes, high blood pressure, high cholesterol, diabetes. So if you have a question that you'd like to ask or any other topic that you want to talk about, I'm a primary care physician, so we can get to you.
No, you're not just a primary care physician. You are the primary care physician. You are the guy that the doctors go to, and we just want to make it very loud and clear. You are a person who has integrity, a person who's not just out here trying to push things. You're giving information, and you do it on a weekly basis on the Ricky Smiley Morning Show, so we appreciate you always being, open and available to the people. You know what I mean? But once again, we got Dr. MJ Collier in the building, one of the most famous doctors you can meet. I think it go like Dr. Fauci, then you. You right there.
Right there with Fauci, but I'm working on it.
You know,
Right there.
the hip-hop doctor.
The hip-hop doctor.
hip-hop
You are Dr. Fauci. We trust what you said. So let's just dive right into it, and then we will have some questions off of Facebook. We may get some live calls on 678-361-3294. But Doc, you just mentioned COVID vaccine reluctancy. Our community, as you know, we got a stigma when it comes down to getting shots and getting vaccinations because of some of the things that have happened in the past. So help us get through that.
Well, absolutely. Let me start out by stating unequivocally, we understand that the history of the healthcare system and African Americans has had some shady episodes and incidences. Most spectacular, of course, is the Tuskegee experiment where they let black men go with syphilis untreated to see what was the end stage of the disease, and that research project went on for more than 20 years.
Wow.
And so long after the advent of penicillin had been available and they could have treated these guys and saved their lives, not only were they infected, but their spouses were infected and sometimes their children were infected.
Yes.
So we understand the history of what's going on now, but things are a little different now. With social media and people like me out here telling you and keeping it 100, we're not going to let anything like that happen to you. So let's start off with the definitive statement. The vaccines are safe, the vaccines work. If you have access to the vaccine, go get the vaccine. Dr. Collier has had both doses. I had my second dose on this past Sunday, and no problems or side effects with it, although I have given it to people and have had people that have had, minor side effects, a few that have had some major side effects, but the vast majority of people get it, get over it, and now they're going to be protected. So there are two pathways to immunity with this coronavirus.
Okay.
And one good thing about getting it so much is that once you've gotten it, you get over it, your body develops a natural immunity, which may be lifelong. So even the ubiquitous...
I'm going to slow you down real quick, Doc,
Okay.
because one thing, when you say your body develops immunity, you get this vaccination, right?
Yes.
The first and the second dose in some cases, and then your body builds up immunity so you won't have to get this vaccination again.
Well, that we're not has mutated. One has mutated in 4 sites, and the other has mutated in 8 sites, the one coming out of South Africa. But that makes it still, the current vaccines are still effective against it.
Okay.
So that's not going to change, and you might be able to get it one time, and once you've gotten your booster, you never have to get it again. They're saying, 2 to 3 years. Natural immunity right now, they finally came out and said that it lasts you at least 6 months. Dr. Collier knows that it lasts you, and then maybe longer. We're finding out in real time, but at least they finally made that definitive statement, because people would ask me, I would tell them, they'd Google it online. I saw online, they say it doesn't last but a month or 2. No, that's not the case. Don't get all your information online, and don't get it all, get you a real doctor to talk to. And again, I literally do 3 to 4 hours of research on this topic on a daily basis with information from around the world. And that's one of the things I want to talk about. Do you know the Russian vaccine, the Sputnik vaccine, has a 92% efficacy, and nobody's using it because it's coming from Russia? You know, so the technology and science is there. It's just, you know, they just say it's Russian. We don't want to use it. We don't know what they're putting in it, etc. But it was available at least 6 months before the vaccines in the United States were available. And so, you know, but even the other people around the world weren't utilizing it, and they could have and probably should have. Now they're opening up to it and embracing it a little more. They still want the Pfizer vaccines, the Moderna vaccines, the AstraZeneca, and the Johnson & Johnson vaccine because they're just more familiar with United States science and technology.
I got you. Now, Dr. Collier, which vaccine did you take?
I took the Moderna. The Moderna is the more potent one, which is why people have a little more side effects to it. Okay. So it has more of the good stuff in it, so to speak, which is mRNA. That can cause, again, everybody who gets a vaccine gets a sore arm. And I tell my patients to pre-medicate yourself by taking a Motrin, Advil, or Aleve starting the day before. And then the next 3 days take it. And you might get a sore arm, but it won't be debilitating. Okay. You don't take that, your arm is going to really be sore. I mean, my wife, Dolores, she got it. She couldn't move her arm.
She didn't listen to the doctor's advice?
Exactly. You know,
come on, this lady.
The pride is never appreciated in this house.
Don't be talking about the missus now.
I just said, come on.
Yeah, and so the second time we got the second dose, she did listen. And she was like, where's that pill you told me I should take? And so we did that. I also recommend taking an antihistamine so that you don't have any form of allergic reactions to it. But
is that why people are passing out, because of the allergic reaction?
No, the passing out has gotten a lot of play in the last 48 hours. You know, people pass out in my office from just getting their blood drawn. That's called a vasovagal reaction. It's always the big guys like him. You know, the little women, I can hold them, but the big guy, I can't hold him, and everything else.
What I do when I have to get my blood?
I have to tie you down.
Oh my God.
I have to tie you down. So that's called a vasovagal reaction, and it does happen.
It was so crazy, because I want to hear about the vasovagal reaction. It was so crazy. She'll sit there and get a tattoo for 3 hours straight with needles.
I know.
And you come trying to help her out with something healthy, and she running.
I can't help it.
No, she say, wait. I say, what are we waiting for? Let me get my mind right. I gotta think about it. No, you don't. just wait. You have to use a big needle like that? You know, we have a 30-minute conversation of what takes 15, 20 seconds.
Oh, we deal with it every day. Right now, we are live on Reec Radio. Your boy Reec right here. My co-host, Miss Juicy Baby, JP, and Bevie Stitch. We got the world-famous Dr. MJ Collier talking about the COVID vaccination, his up-close and personal experience with it, and some of the side effects that we've been hearing about. Now, tell us about why some of those side effects that we've been hearing about.
Okay, well, one, when you introduce a foreign subject, particularly the mRNA vaccines are wrapped in a fatty coat that allows it to enter your blood cells in your body, for your body not to recognize it as foreign, but it is a protein that is not natural. So your body's immune system will react to the local site. Okay. When you get redness, that's called rubro. When you get the swelling, it's called induration. And that swelling can give you a lump. You can literally feel it. And so you want to avoid that if you can, but you can apply moist heat to it. And again, an anti-inflammatory, it is just an inflammatory response. It's an appropriate response to what you just had done. And you probably have had that if you've taken the flu vaccine or virtually any other immunization. But, you know, once again, we are reluctant to get our flu shots. We don't, get our tetanus shots every 10 years the way we should. We are, reluctant to get vaccines, and we should. Literally, the vaccination program through the Public Health Department has been the #1 major effect on public health than anything else we have done under any other circumstances. It has totally eradicated some diseases, controlled all your childhood diseases. You don't see kids walking around with measles anymore or chicken pox. You know, I had chicken pox when I was growing up, but you had them? Okay, I'm going to say most generations, they don't know what it looks like. Right. I had a patient that went to the doctor never seen it. He young doctor. And so he was like, I don't know what this rash is. We need to send you to an infectious disease specialist. I'm like, oh my God. Yeah. So, but when you don't see it, it's not in your vocabulary. You can't make the diagnosis. So understanding that the vaccine program around the world, not just in the U.S., but the eradication of disease has been most effective by prevention, and prevention is via immunization and vaccination. Okay. So I highly recommend that you get it. Once again, if you have access to it, and it's going to become easier to get. You don't have to be 70 years old. You don't have to have 10 health problems. The vaccine has a shelf life. So once it's manufactured, it has to be used.
I heard it's got to stay really cold because it'll go bad very fast.
It will. The clock starts ticking the moment it's manufactured, but then once it's brought to room temperature, you have 5 to 6 hours to use it. Okay. Oh, wow. And so that's why, most of the people that are given the vaccine, people have received the vaccine to give it, but they didn't really have a distribution plan. And so I can't have Miss Juicy come and give her 1 shot out of the bottle, and then I got 9 shots left, and nobody that day is done. I have to throw the bottle away.
Gotcha.
So they really like for people to come in groups of 10. So I tell people, get your friends, your family, your second cousins, your pastor, get a group of 10 people, and go to your local pharmacy. In this area, there's a pharmacy called Premier Drugstore that has the vaccine. There's one called Physicians Pharmacy, which is directly across the street from Wellstar Carp Hospital. They have the vaccine. Okay. So you call them or go to the website and do it. But I've had patients literally leave my office and walk in and get it. And other people, have tried on the website for hours and days and just couldn't get it. But once that vial is open, they are under the clock is ticking, and they have to use it.
Okay. So let me just get my little, I guess, elementary idea of how the vaccine works. So basically, they're putting a version of the disease, not the disease, well, COVID-19 into you, or a replica of it, so your body will know how to fight it. So you said it comes in a fatty tissue, almost like a covert ninja suit.
It's a ninja suit. It's a fatty ninja suit. It's a lipid or lipoid that allows it to get through the cells, because each cell has a membrane around it that is lipoid. So things that go into your body are either aqueous-based or water-based or lipid-based. Those that are lipid-based can do a lot of things.
Okay.
Water-based, it's either absorbed quickly or it disappears or it doesn't get inside the cells. So there's no virus in the vaccine. The vaccine it contains no virus. It cannot make you sick. It cannot give you the coronavirus. Right. If you take the left arm of the vaccine, or I don't even say that much, I'll say the left hand of the vaccine, and that's enough for the antibodies to recognize it and to manufacture a potent army to fight the vaccine, but it can't cause disease. So, but the vaccines have what's called mRNA, which is like, I've heard it best described as like a contractor building your house. He directs. So the mRNA goes into the house and it directs all the workers in there what to do. So this mRNA, it goes to your genetic system, and your genes make the antibodies to the coronavirus. So again, it cannot make you sick, cannot give you the coronavirus in any form or fashion. This is totally new vaccine technology.
Got you. I got you. So and I just in layman's terms, you have a girlfriend that doesn't treat you right, you get rid of her, and then when the next girl that comes in that starts acting like her, you can get it about it fast before it affects you totally.
Because you recognized it.
Absolutely. There we go. That's the best way
to give him a shot like that just for that statement. Give him a shot.
You can recognize it and you say, oh, I know toxic.
We're not doing that.
I'm not doing this again.
Hey,
I'm not going to suffer from this.
At all. We're not doing that. We're living that twice. Listen, we got the world famous Dr. MJ Collier right here on Reec Radio with me, Reec, and my beautiful co-host, Miss Juicy Baby. One time for JP and Bevie. Now listen, so a few people have chimed in on Facebook. Some people coming in, as they come in. So Michelle was asking, did you get your shot? Yes, he's gotten his shot. And you've gotten both rounds of that vaccine.
I've gotten both rounds, and I pre-medicated myself with, again, an anti-inflammatory and a non-sedating antihistamine, like Zyrtec, Allegra, Claritin. You've all heard of them. And no side effects of substance at all. My arm was barely noticeable that it was sore. But again, I did a round of 20 vaccines at my office 2 weeks ago. 6 of those people had side effects potent enough to call me on Saturday. I did it on Friday. So on Saturday and Sunday, I got calls from 6 different people. I heard later from maybe 3 more, that they were questioning certain side effects. Had one that got what's called a COVID rash, and that's where you get, just a round red rash. It sometimes can be itchy, sometimes not, but it's swollen and it scares you. Yeah. But it's totally benign. It goes away in a few days. Okay.
So what's the most common side effect?
Just the soreness in the arm.
Okay.
But the side effects that get people's attention are fever.
Okay.
Body aches and chills. I mean, you feel like you've gotten the disease, and
is that your body
haven't
reacting?
gotten the disease, but your body's reacting the way that it would if it was under attack by any other pathogen. So it makes you feel sick, flu-like symptoms, if you will, and it lasts anywhere from 24 to 72 hours. After that, most people have recovered. The vast majority of people have recovered.
Okay.
Now, Dr. Collier, if you have a precondition like high blood pressure or something like that, or pre-diabetic, and you take this vaccine, do you recommend them to take a pill also before they do it too?
Yes, I still recommend that prophylaxis. And now the CDC and the World Health Organization have come out with recommendations that those are the people that need the vaccination more so. Those with pre-existing conditions, the most common being diabetes, high blood pressure, and high cholesterol, affectionately referred to as the metabolic syndrome, and disproportionately affecting African Americans and people of color. So if you have those disease processes, and everybody does in their family, then you qualify for the vaccine. And those are the people that should. That is not a reason not to get it. That is a reason that you should get it, and get it as soon as possible. So, but you know, they went through every disease process, and this is, I didn't agree with. You know, everything from cancer to HIV to, you know, to having had an organ transplant. They were saying there's really no reason for any of those people not to get the vaccine, and yes, there is. You know, but they put a caveat in there and said, well, we don't have any research to determine that safety and efficacy in those patient populations, but we do recommend that everybody get it because the risk of getting the disease is higher than the risk for a potential side effect for the vaccine. I stated that if you have one of those conditions, HIV, or you have been had an organ transplant, or you're on anti-rejection medications, you need to form a good partnership with your physician provider so that they know what's going on and they're prepared for any potential adverse reactions that you could have to the vaccine. That's not the time to show up, you know, that 4 hours later in the emergency room where nobody knows you. You know, everybody needs to know what your health history is and how to take care of you. Because they give you the shot, you wait 15 minutes and then you can go. If you have certain diseases, they make you wait for 30 minutes and then you can go. Okay. But if you know, in the parking lot, minute 32, and something happens, you got a problem. Yeah.
I understand that. Right now, we got Dr. MJ Collier right here, Reec Radio. We're talking about things to look out for when getting your COVID vaccination and getting rid of some of these things of preconceived notions about the vaccine that may not be true, may or may not be true. I appreciate all this information. What's making you so passionate about this? I see you speak passionately about many things, but this one,
you know, my goal in life is to make sure that African Americans get the same quality health care that they can get, you know, above I-20 versus below I-20. And I'm a firm believer that culturally sensitive healthcare is so important. If you go to a healthcare provider that doesn't understand the black experience, you know, doesn't understand. I've had patients that, you know, had a skin rash that was, grandmama would call it tatter. She knows exactly what to do. She put Blue Star ointment on there. You know, it cost you $3.
Or some cigarette buzz.
Or some cigarette, something. You know, they go to a dermatologist who's never seen it, gets the $1 million workup, including biopsies and all that kind of stuff, and still not quite sure what the diagnosis is. And I look at it in, you know, in 30 seconds and tell them, oh, this is all it says. I can give you this and I'll take care of it. And it clears it right up. So again, it has to be within your experience. Not saying that you cannot get quality care, but again, for people that know what you are, who you are, the things you eat, the places you go, the things you do, that you're going to put this salve on this ointment because that's what you grew up and raised to do, then people need to know those things. And I can assure you that the quality of health care and understanding is much higher and much more specific to your disease state.
I think it's just to understand. It's just like with a politician, we say you got to vote for the people that represent you. It's just like with schools.
Exactly.
To the barbershop. Exactly. You know what I mean? So I can appreciate that information. Doc, with COVID-19, what are some of the signs? I know we've been reading, like you said, you can't get all your information. We want to go to the horse's mouth. You are the guy that deals with this. With COVID-19, what are some things that you could do to preventative if you have people in the house reluctant to go get the vaccination?
Okay, and these are things that I have been saying since day one. The most important supplement that you can take is vitamin D. Vitamin D. It's the first thing that they put you on if you get a diagnosis of cancer.
I'm with a child, right? Vitamin D. The juice's mind goes straight to the gutter. Can you please get to the real information?
The real vitamin D. Vitamin D3 preferably. It comes in D2 and D3. D3 is the preferred molecule. And the normal range on a vitamin D is 30 to 90. 9 out of 10 people that I see in my practice and around the world are vitamin D deficient. We have no idea why. Is it something in the environment? Are we just not getting sun exposure because we worried about cancers and that kind of thing? So people aren't getting, don't have normal vitamin D levels. And so there was a statement made by the World Health Association. If we could get people's vitamin D levels up to 40, it makes it an unfavorable environment for not just the coronavirus, but influenza A and B, most other viral infections, bacterial infections such as streptococcus and staphylococcus, which causes pneumonia and strep throat, fungal infections like toenail fungus, jock itch, vaginal yeast infections for women. It just protects you from all of those things. Once you get the level above 60, Remember, get the normal range is 30 to 90. Then it protects you from breast cancer, colon cancer. I mean, you just can't get those things if you have that cancer of your female organs. And so, it's very important. It's a simple, very inexpensive supplement. So there was a study done in a small town. 2 doctors, one that worked at the hospital, the other was one was an emergency room physician, the other was a primary care doctor, and they decided they was going to get everybody in town on vitamin D.
Yeah.
They're going to try to get their levels above 40. And the way to do that is you either take a daily dose of 5,000 international units, that's the unit of measure, or a weekly prescription dose of 50,000 international units, and just see what the rate of coronavirus in that patient population was. Amazing result. Again, very inexpensive. They could do it tomorrow all over the world and just say, everybody take a vitamin D. Not only wearing your mask and socially distancing, take your vitamin D, and we can shut this down in 2 weeks.
Sheesh, that puts you out of a job, though.
Well, I don't want to deal with this. I'd much rather deal with high blood pressure, diabetes, high cholesterol, all those things that, because, again, that's why my office never closed, and a lot of doctors' offices are still not seeing patients live. They're not doing elective surgeries. I had a patient that had a rectal bleeding yesterday and had to be rushed to the emergency room because the doctor that they normally care for said, well, have you had a coronavirus test in the last 72 hours?
So they can't even see you for regular stuff.
Can't even see you for regular things. And people with, chest pain, heart attacks, car accidents are being turned away from emergency rooms because they don't want to come in for potential infection with coronavirus.
Yeah.
So healthcare as a community has deteriorated because everybody's so focused on the corona, they're not doing basic routine healthcare.
Okay.
Gotcha. We need everybody to go out there, get you some vitamin D right now. Like Doc just said, try to lower your chances of getting sick all around. To stop cancer by getting that level up, that's crazy.
Yeah, multiple. Now that's one thing. Google that.
Yeah.
Google vitamin D therapy, the treatment of cancer. But I tell you, anybody that's diagnosed with that, anybody that's diagnosed with HIV, any kind of challenge to your body, first thing to do is put them on vitamin D.
Wow.
And so I've had people that were being admitted to the hospital with coronavirus before we had the vaccines and we still don't have any real therapy. There's still no real treatment. The vaccines stop you from getting it, but once you get it,
what do you do? And that was my next line of questions. What do you do when you got because I have a grandfather. My grandfather just got COVID-19, right? He said, but he's not having breathing issues or anything. He's just having a issue with he can't smell or taste anything.
Okay, so see, that's the first sign that things could go down here rapidly. He might not, but they could. So I've had this phone call at least 5 times today. People calling in and out saying, look, one, go to my website, lifeodrops.com to get more information. But start taking a regimen that includes a decongestant mucolytic, like I recommend Mucinex DM maximum strength, 1 twice daily. I recommend a non-sedating antihistamine, of which there are 5. There's Claritin, Zyrtec, Zysol, Allegra. And so when you take that, I prefer Allegra in this scenario, but any one of them that works for you that you can get.
Why you prefer Allegra?
It works better for skin manifestations, and if you have allergy symptoms that are more centrally located in your, like sinuses, etc. The others work good as well. Everybody has one that they swear by, but but my personal recommendation is to use the Allegra. And all of these now are over the counter. They used to be prescription medications. Right. So Mucinex, Allegra, start taking the vitamin D. Start taking vitamin C at 1,000 milligrams per day. Then you can supplement with zinc. Zinc is such an amazing compound because literally after the very first tablet, your immune system is boosted within a matter of hours and you are fighting infection. Everything else has to build up, even the vitamin D.
So that's kind of like an emergency.
Exactly. I think emergency has vitamin C and zinc in it. But I know that you can get zinc at a dose of 30 to 50 milligrams per day. So I've given that advice to everybody at least, again, 5 times per day, but I've been saying that since day 1 of the pandemic. And finally, maybe 3 to 5 months in, you started hearing about it, with regular media and other doctors saying, we should do those things, particularly with the zinc. Exactly. And then once they got off the hydroxychloroquine bandwagon, they realized that, some of these supplements, because the simple things Mother Nature provides, and again, the vast majority of those things aren't even medicine. They're natural supplements.
Gotcha. Now,
the 2 medicines, again, the non-sedating antihistamines and the anti-inflammatories. And so those are the things that will relieve your symptoms and are primary therapy for this. And so that's what I do. I'm actually, I do recommend that if a person has a moderate to severe disease, they can get the infusion of the antibodies. There are 2 products. One has 2 synthetic antibodies. The other has 3 synthetic antibodies. They have this stuff sitting on the shelf in the hospitals, not even being utilized. And it's the only active therapy Everything else is putting you on a ventilator till you get through it.
Yeah, why is that? Why do you think that is?
That's a good question. You know, I have no idea why that is. Or people, I don't even think people are reluctant to do it. They either don't know about it, and you know, and let's say the economics of medicine, insurance companies don't want to pay for it, and so that's a problem. The course of therapy though is, you know, $3,000, $5,000, which is not that much in the hospital.
Yeah.
You know, but they're recommending remdesivir, which just decreases your supposedly. How you measure this scientifically is beyond my comprehension, and I do research.
We see that.
Many research projects. Now, I mean, I actively do research on various things, but when they come out and say, well, you normally would have symptoms for 14 days, and this could cut it down to 10 days, possibly saving you 2 to 3 days in the hospital. That's not what I would call good treatment or therapy. You know, that's something. And when there was nothing, but people jumped on that bandwagon, and so they get in the hospital. They would put them on that usually, and again, if they deteriorated to, you know, oxygen saturation that required them to be on a ventilator, they'd be on a ventilator. And after that, you just supported therapy until they got through it. A lot of people don't get through it, and you know, it was a problem. But right now, the only active treatment is the synthetic antibodies that have been developed, and that again was a breakthrough in science. Yeah. Now they've been doing this synthetic antibodies to treat cancer therapy, cancer tumors, because it's not toxic like chemotherapy is. Yeah. So it only kills cancer tumor, doesn't do any other damage. You don't lose your hair, you don't lose weight, you don't do all those things.
Oxygen-based treatment?
There's oxygen-based treatment as well, but this is just a specific antibody that goes right after tumor cells and tumor cells only.
Gotcha.
So this is going to change a lot of things in medicine. This new vaccine technology, the old vaccine technology has been around, and it has been exactly the same with some minor tweaks since 1930.
That's the issue.
Yeah. So now all of a sudden we got something new, and people say, "Oh, they came up with that too fast. I need to see." You know,
but they've been doing research on this for a long time.
They have been doing research on it for a long time.
And other, it mimics other diseases that we've had.
That's exactly correct. Reece, you are well informed.
I try to be.
But I'm telling you, this is a problem. This is a problem.
Oh, that he's well informed?
No, that's scientific.
It's
definitely a problem that I'm well informed on certain things.
And this is why this is a process. You know, doctors are trained the way that the older doctors train. They teach you the way they learn. Yes. And so the same techniques and technologies are passed on from generation to generation. And before the internet, it took 20 years to change anything in medicine, because you get, one doctor, he grow up in prosperity, he become the chairman of the department, and it would be Dr. Jones's way of treating cholesterol. Yeah. And so I could tell what part of the country a doctor was trained in. I like to use cholesterol as an example, because they chose a drug called Zocor. They were trained in, like Harvard, Yale, and North. If they were trained on the West Coast, they use simvastatin or Zocor. And they were trained on the West side of the South, it would be atorvastatin.
Yeah, if they were trained in the hood, it'd be nice.
There you go. It'll be nice. It'll be nice. And I'm so glad you mentioned in the hood, Reece, because the same people that say, "Well, I'm not sure about this vaccine," will go into a 7-Eleven and see a pickle pig feet jar on the counter that's been there for 3 months, and had the nerve to be specific about which one they want.
Hey,
give me this one right here, and they start eating it before they walk out of the store. And I say, so some of the things
but
we
you don't
eat,
want the vaccine.
some of the things we drink,
drink.
some of the things that we do without hesitation, and we're reluctant when we got real science right here that is showing you these vaccines are safe. And again, my personal opinion is, and having taken it myself, get the vaccine, get the vaccine, get the vaccine.
All right, man. Dr. MJ Collier, we appreciate you, man. We know you got to get back to that clinic. Tell them to get to your website, because what I do appreciate your website, man, you got meal plans on there.
Yes.
You tell people about how to diet. You tell people about your lipo drops. Tell them about the lipo drops.
Yes.
I ain't getting surgery, but I'm doing drops. Talk to me.
We're in January now, which is #1 weight loss, but everybody makes their commitment to trying to lose weight this time of year. So we created, and this is my personal product, it's proprietary, about 12 years ago, a product called Lipo Drops, because the objective to weight loss, you can always, I guess you can say, reduce your caloric intake. That is what what I call strip mall weight loss program does. The Jenny Craig's, the quick weight loss and stuff. They restrict your calories, and if you do everything they tell you to do, exactly the way they tell you to do it, then you will lose weight. There are 13 programs like that, okay? The problem is, as soon as you stop, you gain it all back.
Yes.
And that's people cycling in to go from one program to another program, and they do it over and over and over. And every time you cycle or you lose weight and you gain weight, you lose weight, you change your somatotype. Everybody remember when Oprah Winfrey lost 68 pounds and rolled that little red wagon out with all that body fat on it?
Yes.
And she lost all that weight. Then when she gained it back, she was unrecognizable. Because when you lose weight, you lose muscle and fat in a ratio of 2 to 1. So if you lose 15 pounds, you're going to lose 10 pounds of fat, 5 pounds of muscle.
Okay.
But when you gain it back, it's going to be all fat.
Oh.
So every time you cycle now, you're replacing the
fat.
muscle. So you have less muscle and more fat. So now you go from possibly being overweight but looking thick and fit.
Yeah.
Now you looking doughy. And then your health status changes, you're more susceptible to high blood pressure, diabetes, etc.
Yeah.
And again, it took a long time for her body to finally recorrect, particularly her facial muscles. They had deteriorated so much you literally couldn't recognize it.
Right.
And so now she's better, of course, and she diets in a much smarter way. But my objective, my weight loss program, is to alter your metabolism, i.e., metabolize fat in a more efficient manner.
Okay.
And there are certain amino acids that are necessary for the metabolism of fat, but as we age, those amino acid levels go down. So you remember when you were, in your teenager, in your early 20s, you say, boy, I'm going to this party this weekend. I got to lose 5 pounds so I can fit in these jeans, right?
Right.
And you start dieting on Monday, and on Friday, you lost 5, sometimes 10 pounds. Women very easily could do that. Then all of a sudden they're 30 years old and it's very difficult to do. Then once they've had children,
I look pregnant. It's crazy.
Exactly. So by the time you're in your 4th decade, you have such low levels of these certain amino acids that you cannot efficiently metabolize fat, and most of the things you eat are converted to fat.
Right.
So the lipo drops are those amino acids and then a few other things too, and particularly vitamin C and B12 because it helps with your metabolism. So.
Nice.
Most products you take a tablet, your stomach digests the tablet and destroys most of the medication. So the lipo drops are given sublingually under the tongue.
Okay.
And so you're like if you take a nitroglycerin tablet, if you're having chest pain, almost instant relief. So it's absorbed under your tongue. You hold it under your tongue for 2 minutes, and then that's it. You can swallow it, spit it out, whatever you want to do. And so that allows you to more efficiently and effectively metabolize your foods, and you just start to melt.
Okay, I like to start to melt. I'm gonna have to start to melt this weekend.
It actually tastes pretty good.
Yeah.
I mean, it tastes really good. The lipo drops. I mean, because some medication or some things, or even
like
drops,
nasty
it has a little nasty aftertaste. That don't even have aftertaste at all. It really tastes good.
I like it. So when I come back on work Monday, fine. You know what I do?
No, child, whatever. It's gonna take more than that.
Miss Lee on Facebook wants to know where to get the drops. Can you give our website one more time?
You can go to lipodrops, LIPODROPS.com. You'll see my picture when you log in. Make sure you put www.lipodrops.com because there are a few pirated websites now that are trying to take advantage of it. So if you see my picture, you know it's the original lipo drops. Yeah. And people, what do? We see something, it works, we say, well, if a little works, then a lot must work better. Right. So people started taking more of the lipo drops than I recommended, and they were losing more weight. So I said, okay, I cannot argue with success. So I did a clinical trial, short little clinical trial, and found out that was indeed the case. So I increased the potency by a factor of 10. So the new lipo drops maximum formula is 10 times more potent than the original lipo drops. And there are 3 formulations. There's original, there's lipo drops, and there's lipo drops with mango. Right. So that's a African mango, which is another natural weight loss supplement.
Got it.
So all those things and more information on the website, lipodrops.com. Go get it. And then, you can reach me at all social media at ASK Dr. MJ. Go to my YouTube channel, get a lot of good information on it. And hopefully I'll be a guest again on Reec Radio.
Hey, come on, you're a staple of the community now, the Reec Radio community. Doc, we appreciate you, man. Thank you so much once again. Catch him at all social media at Ask Dr. MJ. All the MJs are great. MJ Collier, MJ, Jordan. You got Michael Jackson, all of them, man. We love it. Magic Johnson, all of them. We got you, man. So, Doc, man, once again, thank you so much. You got so many thank yous coming in on Facebook feed right now. It's ridiculous. So, yeah, you're going to have to come back, brother. They're going to jump me.
All right. Well, we'll be happy to do so, Risa. I'm so glad, that I love this studio. It's absolutely incredible. Most radio station studios are less than. They sometimes not quite top notch. This is a really nice facility. I may steal some of this furniture and take it down to my office.
Hey, you got to talk to that man back there, man. He designed it. Pops will design it over there. So.
Great job right there. All right, I'm going to bag my rental truck up to the wall.
As long as we can get some free clinic visits, we're good. We can swap it out.
Hey, we can do that. We can do that. But thank you so much. And again, go to the website. You can reach me. My office is Atlanta West Primary Care. I'm here in Atlanta. The phone number is 770-948-5855. 5400 770-948-5400. I'm at I-20 West and Thornton Road, one exit west of Six Flags, right next to the Home Depot.
Yes, sir.
Okay.
All righty, then.
All right, man. Once again, let's give this man a round of applause and flowers. Thank you for all your research,
And the crowd goes wild.
efforts, your energy, and we appreciate you. And we'll see you next week.
All right. Thank you,
Saw how
Miss
it is,
Juicy.
all right? You saw that, right? All right, y'all. We're going to take a quick break. Then we right back at you live, man. We got Jeremy Anderson in the building. We finna talk it up. He going to get you motivated to get that check, that cash. And if you ever been through something and you need to get past that thing, he going to tell you how to do it right here on Reec Radio, all right? Plus, Juicy got some entertainment buzz. Somebody done dropped the OnlyFans page that she was very excited about.
Sure is.
So I'm finna go take her credit card so she can't do no wrong. See,